Welcome to Podcast UK.
Are you a surgeon who likes using absorbable sutures? Of course you are, and I bet you love using absorbable sutures because, what's not to love, eh? Now you stitch the wound closed with an absorbable suture, then you can forget all about it because absorbable sutures, they dissolve, don't they, by themselves, and we don't need to remove them. Of course, that's dissolve in inverted commas. But here's the thing. Do you know how many days the absorbable sutures you have used will actually give the incision or wound the support the tissue requires before it eventually heals? And equally importantly, do you know how many days after it has stopped being useful, that is to say, supporting the tissue, does the suture material keep hanging around, causing an inflammatory reaction, increased scarring, and of course an increased risk of infection until the suture material eventually becomes resorbed. Hi, I'm Majumder. I'm a plastic surgery consultant, and for this, one of our shorter Cappuccino Break episodes on Podblast UK, we'll have a look at some of the most commonly used absorbable sutures in the UK and look at some numbers. Right, now let's start with Vicryl Rapide. Now, Vicryl Rapide will support a wound for up to 10 days. After 10 days, Vicryl Rapide is not strong enough to support the tissues. However, Vicryl Rapide will take up to 42 days before it is completely resorbed. Vicryl Rapide is a great favorite amongst many surgeons and is not uncommonly used for incisions and wounds on the hands as well as on children's faces. Now, in my opinion, 10 days is not long enough to allow for reliable wound healing on a hand, where 14 days is the conventional period required. And 42 days, that's way too long for suture material, especially braided suture material, as Vicryl Rapide is, to be hanging around in a child's face. Too much inflammatory reaction for too long with the increased risk of lumpy scarring and, of course, the increased risk of infection. Now, for these reasons, I'm not a fan of Vicryl Rapide for either hand wounds or children's faces, but that's my personal opinion. The next one is Vicryl. Now, Vicryl is Vicryl Rapide's bigger brother. Vicryl will support a wound for up to 30 days, plenty of time for skin to heal. However, Vicryl does tend to hang around the tissues for 55 to 70 days. And because it's a braided suture, like with Vicryl Rapide, there's a greater inflammatory reaction than with monofilament sutures, with the increased risk of lumpy scarring and again the increased risk of infection. So let's now go on to the commonly used absorbable monofilament sutures, which in the UK are Monocryl and PDS2. As these are both monofilament sutures, there's obviously less tissue reaction with less scarring and less risk of infection. However, as the knots are not as secure as with braided sutures, most surgeons tend to use more throws when knotting a monofilament suture, resulting in more suture material being left within the wound. Also, monofilament sutures are much more rigid than their softer braided cousins. As a result, the cut end of a monofilament suture can be pointy and rigid, like the point of a spear, and if left too superficially on the skin, can be a focus of tissue irritation, pain, or even can lead to infection. First, absorbable monofilament suture we will discuss is Monocryl. Monocryl will support a wound up to 20 days. Again, plenty of time for a skin wound to heal, but not long enough to allow a tendon to heal because, as we know, a tendon requires at least 6 weeks of support. However, Monocryl will take up to 120 days until it is completely resorbed. So, up to 100 days after it has stopped giving any meaningful tissue support, Monocryl will continue to hang around the tissues, acting as a foreign body. Now, finally, PDS2. Now, PDS2 will support a wound for up to 60 days. And because of this extended period of tissue support, PDS2 is the favored stage of some surgeons for tendon repair. And there's plenty of evidence showing that this is certainly an acceptable choice of suture material for tendon repair. However, PDS2 can take up to 180 to 230 days, so 6 to 7.5 months until it is completely resorbed. And that's a very long time for absorbable suture material to be hanging around the body, especially if it's just under the skin. So there you go, some interesting and I think some very important information that many surgeons regrettably may not know about the more commonly used absorbable sutures in the UK. I hope this helps you make an informed decision when you're choosing an absorbable suture material. If you prefer a visual representation of the information we've discussed, there's a video with the same information on my YouTube channel, Medicine in a Nutshell. If you think this Cappuccino Break episode was interesting and informative, please follow us on Podplast UK and do tell your friends and colleagues. Happy suturing!
Podplast UK is a collaboration between UK plastic surgery trainees and consultants. The content reflects individuals' practice and opinions may vary. If you have any feedback, do get in touch. We hope that this has been interesting and useful. If it has, remember to follow us for future sessions.